One of my soapbox issues in veterinary sports medicine is cruciate ligament disease. I say disease rather than just injury because there are a host of issues that go into this condition. When we think of an issue with the cruciate, it is most commonly the front of the two cruciate ligaments. So the ACL in you and I and the cranial cruciate ligament in our canines, which ACL is fine for them too. The function of this ligament is to keep the shin bone from sliding forward on exam when we are evaluating this ligament. We are looking for this movement either through drawer movement or tibial thrust. When you hear people talk about a partial tear, this is also based on these exam findings and how those bands that make up the cruciate respond to flexion and extension during the exam. During different ranges of motion, those bands can act differently. And so with drawer motion is important that is being checked in extension and in flexion, as this can delineate a partial tear from a full tear to no tear. A couple of important points on diagnosing this injury. You cannot see the cruciate ligament on x-ray. You can see evidence of cruciate ligament disease. So things like effusion in the joint, displacement of the infrapatellar fat pad, and in some cases, even drawer positioning. The drawer thing on x-rays is caught pretty infrequently though. So for all intents and purposes, an x-ray only provides evidence, not a diagnosis. As far as imaging goes, you could see this on an MRI, but with the cost of MRIs, you're looking at nearly the same price for actual surgical correction. This diagnosis is made typically based on the physical exam. There is an art to this, and it isn't something that all veterinarians are good at determining, particularly with bigger, well-muscled dogs like our sporting dogs. When I tore my own cruciate and meniscus nearly 25 years ago, it was also missed on initial exam, and it took about 3 years to get an accurate diagnosis. And even then, the first orthopedic surgeon misread my MRI report. If your dog has a rear leg lameness and your vet thinks it may be the cruciate but can't confirm it, there is no shame in having someone that performs these exams more regularly give a second opinion. I see far too many dogs go misdiagnosed or undiagnosed and thus not surgically corrected based on just not having a thorough exam performed. It is important to note that there are a number of factors that can contribute to this injury as well. Just as in you and I, it can be an athletic injury. Honestly, this time of year, I'm always reminded how athletic these dogs are and how amazing it is we don't see more traumatic injuries while out hunting. I can't tell you the number of times I misstep into a badger hole or either hyperextend my knee or feel like I'm going to snap my Achilles and I'm just walking. How these dogs are able to go full tilt through cover and rarely suffer a misstep, it's incredible. We also know there is a genetic component to this. Nearly 20 years ago in 2006, Dr. Vicki Wilkie and her colleagues, then at Iowa State, published a study about the inheritance of this issue in Newfoundlands. Dr. Wilkie was a resident at Iowa State when I was in vet school, and I got to know her quite well. Back in 2008, during my first run of Gun Dog Doc podcasts, I did an interview with her on this subject, and at that time, she thought we were within a year of having a test available for Labradors. It took a bit longer than that, but recently the University of Wisconsin started offering a test to show the risk of cruciate rupture in Labradors. Not surprisingly, I've only had a handful of inquiries about submitting samples for this test. Genetics is kind of a funny thing, especially in the dog breeding world. It gives us information to allow for better breeding decisions, but too often people are afraid of that information because they don't actually understand it. They look at the result of the test as some sort of scarlet letter. The problem is that genetics is a complex issue and not always the simple Mendelian square exercise that we were taught in high school. There are many factors that need to go into breeding selection, and too often when genetic testing is involved, breeders and puppy buyers want a simple solution, which in most of those cases is only to breed clear dogs. The problem with that, particularly in conditions where carriers do not exhibit the disease, is that you end up potentially eliminating a lot of good genetics from a breeding pool and can actually cause bottlenecking, which could lead to more and in some cases even worse issues arising. In my experience, this leads to two scenarios playing out. The first is that breeders turn just a blind eye to these genetic tests and don't want to be the trailblazers with their use. They will make claims like, "I don't see that in my lines," or cast some aspersions at the test itself. Scenario 2 is that once people start testing, they initially only breed clear dogs, and we end up with some good dogs being unnecessarily removed from the gene pool. Any health test should be treated as information that contributes to your decision-making process and not the end-all be-all. In some cases, based on the two dogs that are involved, there are ways that one dog's genes maybe negate certain issues in a carrier dog. The important point here is that it is dependent on the mode of inheritance in that all traits or issues are not the same on that front. In my opinion, as it relates to cruciate ligaments, I feel we have bigger fish to fry across many of our sporting breeds than to worry just about this test being available only in Labradors. The unfortunate truth is that in Labradors and many of our sporting breeds, there are a lot of dogs being bred that have had both knees fixed. Because it's a correctable problem, for too long, we have been giving breeders a pass on this front. Most people would lose their minds if they knew a breeder was knowingly breeding dogs with trash hips or elbows or shoulders. But for some reason, breeding trash knees has not raised any red flags in most breeds. Maybe because I see the devastation to owners that this really strikes a nerve with me. It might be okay for that person that has a kennel or truck full of dogs to occasionally have a dog on the sidelines, but for the vast majority of people that have one or two dogs, to have a dog out for 10 to 12 weeks, oftentimes twice in their careers, is devastating. It is far too common, especially in labs, to have an owner who spent several $1,000s on a puppy to come in before the first season with the first knee for surgery, only to have them show up prior to the second season with the second knee for surgery. These poor owners have invested countless hours into training. They love the dog and can't wait to spend time in the field with it, and now have somewhere probably between $10,000 and $20,000 invested when you take into account the initial purchase, training, and these surgeries with a 2 to 4 year old dog that's never spent a day in the field. As puppy buyers, we have to start asking questions of these breeders. While a genetic test could contribute to decision making sooner, once a dog has a cruciate surgery or two, you sure as heck have enough information to start making some decisions about not breeding that dog rather than trying to sell more semen or puppies in order to recoup your investment. Early in my career, cruciate ligament issues were widespread in labs and Goldens and not too common in many of the other sporting breeds. Now, we see it commonly in dogs that we never used to see it before. I feel like I'm just as likely to have a blown cruciate in a wire hair, a short hair, and even pointers as I am a lab or a golden now. My contention is that it likely is not all genetics in the way we traditionally think of genetics and genes, but rather as Americans, we like a certain look in our dogs and we are conformationally breeding for it. When we talk about surgical correction in the next video, we will discuss angles and correcting angles, and I often wonder if this is something we have changed inadvertently over the years in some of these other breeds as we Americanize their appearance. As with many of the conditions I discuss, prevention is always better than correction. In an ideal world, you will choose a dog from lines that don't have cruciate issues, and you will never have to experience having a dog go through cruciate ligament surgery and repair. This starts with researching the issue within the breed you are choosing, and more specifically, the lines within that breed. Once you have a lame dog, the next step is going to be to get an accurate diagnosis so that you can get the condition corrected and get the dog on a path to getting back out in the field. For those of you that have had a dog with a torn cruciate or with a breed prone to these issues, in the next video, we're going to tackle surgical repair.